It's good to talk again to a few of my friends down under. Hopefully someday you'll get out of jail and be able to come and travel a little bit, but at least I can chat with you this way. I've been asked to talk about disruption, and there's been obviously a lot of disruption going on, beginning, of course, with COVID. But I think there's more to cover in this area, and I want to begin with that, and then we'll transition into a discussion of how I, in my practice, have addressed disruption in response to all of this. So let's get going. Okay, these are my credentials. Those of you who know me, you know I lecture all over the place, so I'm not going to go any further. So what's the elephant in the room, and what really has changed how I practice in my office and how we practice forever? Let's begin with disruptions. And now, disruptions today, the term is irreversible changes in products, features, or processes. But those of you who've taken courses with me, you know I talk about paradigm shifts. And what the issue is with a paradigm is that when it shifts, all the old rules are gone. The way we used to do things no longer work because there's new rules to the game. Everyone goes back to zero. And because of that, those who embrace change are the true winners in a disruptive world, which is certainly what we're living in today. So let's begin with a discussion of a few of them. 1974 in the United States was the first dental reimbursement system, and that was a disruption. And dentists in my country looked at it very favorably. They saw it as an opportunity to acquire more patients. But what we also learned at that time was that the dental reimbursement system set our fees. They determined what services we can provide, and they also determined what we could even do. And all of you down under know that because you have reimbursement systems too. The next big disruption, I think, as far as I'm concerned, and I'm not talking about clinical disruptions because there's hundreds of them that have occurred in the last 40 years. So I'm focusing on things that are non-clinical, is aligner treatment. Why it was an aligner treatment a disruption? Because for the first time, we had the opportunity to offer patients aesthetics. Importantly, we learned that they could eat anything they want and drink anything they want too, because they took out the aligners to eat. And what we've learned also is because they could take out the aligners, oral hygiene with aligner treatment was far superior to patients with braces. We also learned something else, which is that aligner treatment allowed patients to have a way to make their teeth better that fit their lifestyle. And we've also learned that aligners allowed fewer problems than we would see with bracket cases. You know, another part of it that's important to this disruption is that Invisalign came along and offered mass marketing to the public, and they had deep pockets to do that. So how consumers were educated on treatment changed completely. And then along came dental service organizations after that as a disruption. Their objective was control market share, and they used the medical model to establish that. They taught efficiencies of scale. They had cost control because of central management and corporate systems to ensure efficiencies and consistency. But they also offered a change in the traditional referral and systems that we've always had in orthodontics, because when corporations get involved, they refer only to the orthodontists associated with their corporation. So traditional methods where orthodontists would win the favor of general dentists in the area because they did good work, those windows were closed. So what we found with corporations is they set the rules of how, when, and what could be done. And they too had deep pockets, which they used to capture market share. 2015 in my country brought a new disruption, which was direct to consumer. And everybody in the world is knowing what's going on with that. Patients are being treated with inadequate records. Poor treatment planning comes from inadequate records. Inferior results occur. In most of these cases, there is no doctor who's involved in treatment planning at all. And consumers, however, found it as the ultimate because it gave them convenience. They never had to see a doctor. And they also found treatment of a nature that they thought would improve their bite, their smile, etc., was priced at a level that they found acceptable. And once again, direct-to-consumer offered something new as a disruption, which is deep pockets to fund marketing. But something else has occurred as part of all this too, and we all have to be aware of it. How consumers shop today is different. Everybody shops online today. You know, the malls are dying because consumers don't go to malls. And in dentistry and in orthodontics, there's no loyalty to the doctor at all because we're all perceived to be the same. And when there's no perceived difference between doctor-provided treatment or mail order care, that certainly is going to influence not only care of patients, but also who is going to provide the care. So consumers today shop based on convenience and price, and that is all. And the phenomenon of COVID just accelerated that process. Those of you who've taken courses with me know that I teach three basic things that are internal drivers for change in the office. The first is delegation. You know, what can the doctor delegate to an auxiliary that by licensure and by training they can do legally and well? Of course, another big part of it is the technology systems that have come along in the last 30 years that have innovated the way we practice orthodontics today remarkably. But the third part is something that I think I taught more than most anyone in orthodontics, which is delegation and technology do you no good unless you have systems that you've incorporated to apply these two things to the practice of orthodontics so that you can provide superior care for less effort and less cost. What I've been talking about so far are disruptions that have nothing to do with these internal drivers that I've lectured on in the past. These new disruptions are all external to the practice. They're third parties that are changing how the practice of orthodontics is done today. So having used that as a background, what are our greatest mutual concerns today? Well, disruption is the major concern. What is it about disruption that bothers us the most? Well, first, it's painful. How we seek patients has changed. How patients seek us has changed. What consumers demand of us has changed, and so forth. And much of this disruption is driven by corporations with deep pockets, by direct-to-consumer marketing that has taught consumers that they can get what they want with little convenience and a better price. We also know that these new disruptions have led to results that are bad for us and bad for our patients. And I think we all know in our heart it's accelerating. So how can we, in this new, strange new world of orthodontics, how can we survive and prosper? Well, first we have to understand there's good news that's going on. Disruptions also created unprecedented demand for our care. Joe Hogan, the CEO of Aligned, has said there's 100 million consumers in just the United States who seek limited treatment. And as we as orthodontists have been practicing for a while know, you know, when we see a patient, what we always presented to the patient was the gold standard, best treatment. We never talked about best or what a consumer may want as an improvement in their smile or their bite. We always offered to them only what was best. And today's consumers don't want best, they want better. And this is best illustrated by a study done by Align Corporation when they had in the United States their Invisalign stores. There's an interesting statistic from those studies. They offered consumers good, better, best. Good was $2,500 to have a maximum of 15 aligners. Better was up to 30 aligners, producing obviously a better result. And best was the kind of treatment that would be done by a specialist, where the specialist would determine the number of aligners, how long the treatment would be, and also the cost. So Invisalign offered this concept to consumers of good, better, best. Well, here's the statistic that I found striking. Those who sought good only represented 5% of the population that went to Invisalign stores or to their concierge service online. 69% wanted better, and the rest wanted best. So if this is what the patients we serve are looking for, you know, we as orthodontists need to rethink, are we prepared to give better and not best? Or are we prepared to work with someone who can do a job that you would call better, so that more consumers are served, so that we can provide quality care that met their expectations? Because we need to understand today's consumers want price and convenience. So how do we respond? As I've said, we have to decide as a profession, Will we give up the gold standard of best for patients who only want better? Because if we don't, who will? Also, we need to recognize, if Joe Hogan is right, that there's a huge population out there that wants better, but not best, who will meet this demand? This demand would overwhelm all the combined orthodontic practices in the world significantly. So we need to develop a mechanism whereby we can provide more orthodontic care for the masses within the time available by the orthodontic profession, because we all would agree the orthodontist should be the driver of care to ensure that there's quality and patients are best served. So our challenge is, if we don't do it, who will? That is the challenge that we're talking about today. And it's the reason for this webinar. Which brings us to really this topic for discussion, which is, where does dental monitoring fit into this new paradigm? Well, first, it's the first and only artificial intelligence powered remote monitoring solution. And it's a process they've been working on for some 5 years, and I've been working with them over that time. It's AI driven, it's accurate. Clinical studies have shown, including University of Illinois study that was done with me, that shows that there is quality of scanning equal to intraoral scanners of today. Because it's AI driven and because of the systems that have been put together by dental monitoring, it's capable of scaling. We can treat many more patients to a higher quality result with this tool called dental monitoring and remote monitoring of care. And we have the ability, because of it, to provide quality and consistency that we've never had the opportunity to do before dental monitoring existed. To give an example of what that is, in my office, we have a large practice. We have to view 2,400 scans a week. Now, for 2,400 scans with dental monitoring and artificial intelligence, we've been able to scale. We can scale and study up to 100 different clinical conditions. And each practice gets to pick and choose those which we want to be monitored versus those that you'll get a report on, but you don't particularly care about. So we can customize what will be reported to us that we want to know about that fits how we practice. It's pixel level accuracy. That is something that you cannot get through other monitoring systems. It's guaranteed timely. A patient does a scan and we have the results within hours. A beautiful thing that dental monitoring has brought that I really didn't understand when I first started with them is the communication systems that have been developed. In the past, before dental monitoring, how would we communicate to a patient poor oral hygiene? How would we even monitor poor oral hygiene if we saw a patient every 6 or 8 weeks or 10 weeks or something like that? By the time we saw them, things were out of control, the hyperplasia was there, etc. It was already too late to turn back the clock and have good gingival health and things like that. Well, now with dental monitoring, we have a tool where we can, on a weekly basis, identify a problem, communicate to the patient via email and text message exactly what the problem is that we're addressing, and correct problems before they become habits. That's an amazing advantage of dental monitoring all by itself. Dental monitoring is kind of like having the perfect employee. And their deep machine learning has led to done by hundreds of skilled AI engineers, gets better and better every day. What I like about it, it's the 3 key principles I've taught for decades in my business courses, which is delegation, technology, and systems at work. Now, there are other systems out there that purport to be providing assessment of cases and monitoring of cases, but I have to tell you, none of them are AI driven. Because of that, they are labor intensive. You, the doctor, get a picture. You, the doctor, have to decide if there's something in the picture that is wrong, that needs to be addressed. You have to go through the labor of communicating to the patient. You, the doctor, have to spend lots of time. And importantly, human error comes into play with something like this. With AI driven, the machine learning makes the accuracy of the monitoring very accurate compared to humans who might look at hundreds of cases a day, let's say with other monitoring systems, where they get weary, they get tired, they get sloppy. You know, it's part of being human. So there is no other monitoring system out there like dental monitoring. What DM is not, which I think is important, is it's not a treatment tool. It's a provider of information for doctors who provide treatment. And it gives doctors information they never before could get. So regardless of how you treat a patient, what mechanic system you use, whether you treat with braces or aligners or whatever, it's a tool that makes your treatment better, more efficient, more cost-effective, more profitable, finish cases faster to a better result. I do believe DM is the future. It's something that has never been there before. And I think it's the greatest disruption of my career in orthodontics. And I think it's the best disruption of anything that I've seen in the healthcare world in my career. I've lectured for years on, if you want to know what's happening in dentistry, or if you want to predict the future of dentistry, just look at medicine. And this is the kind of thing that I've said. 50 years ago, medicine was a cottage industry, individual practitioners doing their thing in solo practices. Now it's $1 trillion business. There are no solo practices in medicine. They're all mega practices. And they became hospital owned, and corporations bought the hospitals, and insurance companies bought the corporations. And insurance companies, at least in my country, are buying the pharmacies, and the mini clinics are being set up in the pharmacies. They've created online medicine with remote monitoring and treatment of almost anything. And of course, we all have to deal with the fact that government regulation and price controls are at play that are driving this, because without those government regulations and price controls, there would be no way to provide care for the masses at an affordable price to governments and insurance companies and so forth. Now, medicine's answer to all of these trends, all these changes, these disruptions that have happened in medicine, was cost control through delegation, technology, and remote care. I'm telling you today that this is our future: delegation, technology, and remote care. But it has to be done right. If you think that this is all new, it's really not. The best example of remote monitoring in medicine was the pacemaker, which came about in 1958. It was a long time ago. But if you look at this screen, these are just examples of remote monitoring of treatment, remote providing of treatment. And this is what's happened in medicine, and it's coming to dentistry, and it's unavoidable. So we have a choice, going back to one of the first slides I began with. We can either be someone who embraces change, grows from change, provides benefits to our patient from change, or we can be stubborn and say, no, I'm going to do it the way I always did it, and become one of the dinosaurs. The key is appointments only when needed. That is the driver of healthcare in medicine today. So let's talk about how I use dental monitoring in my practice. First of all, we use it for virtual exams. Those of you who took courses with me in the past know that I was a big believer in exams, in-person exams and so forth, but our office has evolved into virtual exams, virtual appointments being set by patients at a time at their convenience, that are now plugged into our office systems for scheduling. And why did I make that transition? Well, let's look at the world we live in today logically. Consumers shop online. A consumer may decide that, you know what, I want to get my teeth improved at 9 o'clock at night watching some show on TV. And they're motivated at that moment to do something. It's our job to make it easy for them to do that. It's our job to give them an opportunity to Google search, go online, see who's the good orthodontist, who has the credentials, who's got the best reviews, etc., and make an appointment. And when you give them the opportunity to not only make an appointment online, but importantly, get a preliminary treatment plan online, now you're offering them something that the direct-to-consumer companies are doing, which is convenience. So we use SmileMate and Vision in our office to give our patients that. And what it is basically using the systems of dental monitoring. The patient is able to do a scan of their teeth. We receive the scan of their teeth. We give them a preliminary point of view of what we think their treatment might be and how long it is based upon this preliminary scan. We then tell them we need to see them in the office, have comprehensive records so that we can confirm our preliminary view. This precipitates them coming to the office, are taking the comprehensive scans and so forth, photos, x-rays, etc., so that we can give a proper and valid diagnosis to confirm what was our preliminary thoughts based on photos. Consumers like that. They go from watching a TV show at 9 o'clock at night to finding out what their needs are and the cost that they might incur in getting treatment, to beginning treatment the first visit to the office. Remember, today's consumers want convenience and price, and we can give them what they want. Dental monitoring also offers the opportunity for remote monitoring of treatment. That's true for aligner cases, but it's especially true in bracket cases. The cases that have the greatest number of emergencies, problems, broken wires, wire pokes, whatever you might want to think of as orthodontic emergencies in your practice, those are bracket cases. We can offer patients who have brackets on their as their appliance of choice an opportunity to get their problems resolved quickly. We identify the problem sooner, they finish sooner, and in our office, our bracket cases are treated in 50% fewer in-office visits. I know that bracket cases are more complicated than aligner cases. I know that, I understand that. But again, when we know that what consumers want is convenience, and they can come in and be treated well to a great result in half the visits, that's a practice builder. We also turn to dental monitoring as a way of monitoring patients and retention and observation cases. Instead of having an observation case where you have to schedule them without monitoring to see if, let's say, second bicuspids have erupted, that they're ready to begin treatment. We use dental monitoring as the tool to find out remotely whether they are ready for treatment or not. Patients enjoy and want convenience. And only DM has the accuracy and the communication skills to provide this to consumers. So what you're looking at here is a video that's kind of explains how dental monitoring works. This is an important slide, and I want everybody to take the time to look at it. What I did is I compared our orthodontic practice to Gauge Statistics. What is Gauge? Gauge is a consulting business for 1,400 orthodontic practices in the United States. What you're looking at in this slide is the average number of actual treatment appointments. This isn't putting braces on, taking off, and retention. It's actual treatment visits to the practice of the 1,400 Gauge practices. And what you see at the top of the slide on the right is bracket cases were 19.13 visits for the average treatment. Aligner cases were 12.7. Now look at my practice. Bracket cases are 8 or less. Aligner cases are 4 or less. That's a staggering statistic. And I submit to you, and I can prove to you that we're doing just as good a job, in fact, a better job in less months of treatment, which again is something that consumers want. And the only reason we can do that is with dental monitoring. So let's talk about orthodontic problems. Again, bracket cases are the greatest source of these problems. You know, without monitoring, what do you normally do if a patient calls with a wire poke or a bracket is loose or something like that? You know, invariably you have to have them come into the office or use one of the apps that are out there that can be used to help a patient give you information you need to make a decision on whether the patient needs to be seen. Well, with dental monitoring, if a patient has a problem of any kind, we just activate their app. We tell them to do a scan. I get the scan instantly. It's live. And it's HIPAA compliant, it's safe and so forth, it's codified. And basically I can see the problem, I can address the problem at the moment, instantly, but only because of dental monitoring. And again, with bracket cases, it's way more valuable than with even aligner cases. So looking once again at the medical model, I want to emphasize this: quality care requires remote diagnosis by a doctor who is qualified to do diagnosis and treatment. So in orthodontics, that means, in my mind, a specialist, an orthodontic specialist, should be doing the diagnosis and treatment planning of all orthodontic cases. But importantly, the specialist also should be remotely monitoring the treatment of a case, whether it's done by the specialist or someone else. This is how it's done in medicine, and I think this is the future of dentistry and orthodontics, whether we like it or not. Because without these features, there is no quality. And also, as in the medical model, there is no savings in cost. And cost is the driver of healthcare around the world. So what are the benefits to me as a practitioner using dental monitoring? Well, first of all, I can feel good about doctor-driven diagnosis, treatment, monitoring, and the results we can produce, giving patients the convenience of fewer appointments and price. We're getting superior results to what we had before dental monitoring and less time and fewer visits because we're finding problems sooner, we're addressing them sooner. Oral hygiene is just the best example I can give, which is oral hygiene is infinitely better because we are telling them on a weekly basis if their brushing isn't right. And with dental monitoring, we can actually use the tool with the photos to show them the area where they're missing. And we can have them do another scan instantly and tell them, look, you've got it now or you haven't got it now. It's a hugely valuable tool for patient compliance of all sorts. There's less cost when there's fewer visits. You know, every practice that I'm talking to tonight probably has tried to do some sort of analysis of, you know, what is your cost per visit? I can assure you that if you're treating patients in half the visits and all the attendant cost of an in-office visit with staffing cost and supplies and everything else, you're going to make more money per case. And if you're doing that without a loss of quality, you win. Not only because you make more per case, but the word gets around that yours is the practice that offers convenience. The efficiency that comes with this is huge. In last year, in 2020, or this year, 2021, our practice grew 25%, even with COVID. We grew 12% in 2020 at the height of the beginning of COVID. We grew 25% this year and will grow 25% more next year, even in a COVID world. And we're doing it in fewer doctor days with fewer staff. Okay, so hopefully I've got your interest. So let's talk about how dental monitoring works. I know some of the people on this webinar are using dental monitoring, but some are not. So I'm going to give just a basic understanding of how dental monitoring works. And I'm going to begin with the basics. It begins with an app the patient downloads on their phone. Smartphones, of course, are a paradigm shift that's changed the world, haven't they? Everybody has a smartphone. They live on the smartphone. They shop on the smartphone. They talk to their friends on the smartphone. Well, we added an app, a dental monitoring app, that allows us to not only monitor their care, but communicate with them on a regular basis, efficiently and effectively. So the patient takes a video using the app. The photos are formatted. AI does an analysis. Incidentally, all of the information in dental monitoring is stored in the cloud, so you don't have to deal with the expense of high quality photographic images being stored on your server or anything else. It's stored in the cloud, but it's available to you on the DM dashboard, and it's fast. DM will analyze with artificial intelligence the things that they see that you have identified you want to know about, and they give you a report. And the report allows you, with efficiency and scalability, to monitor the treatment of your cases with little doctor time, as you will see as I go on in the slides. The key to it all is the scan box.
Stand in front of a mirror. Open your dental monitoring application. The application is intuitive and will guide you. Press the Take Scan button and follow the instructions.
Place your phone into the scan box and latch it in. Insert the cheek retractor and snap the scan box into place.
Position the arch downwards. Insert one side first, then the other. You will hear a click when your scan box is properly attached to your retractor. During the scan, audio instructions will guide you through the steps. Let's go.
Double tap on the screen to start the scan. For this step, bite down on your back teeth and keep your teeth together.
Start moving your head as soon as you hear the camera make a sound.
Shift the scan box to one side. Now, shift the scan box to the other side.
Make sure you move the scan box at the same rate as the progress bar. Scan all the way to the side to make sure your back teeth are well seen. You can also turn your head slightly in the opposite direction if that is easier.
Back to the center.
If you need to restart the current step, simply press the Restart button.
For this next step, you'll have to keep your teeth slightly apart and scan side to side.
Open your mouth just enough for your tongue to fit in between your teeth.
For this next step, you'll have to open wide and scan up and down. Open your mouth as wide as you can. Tilt the scan box up.
You can also tilt your head slightly in the opposite direction if that is easier.
Now, tilt the scan box down. Back to the front. Insert your aligners. Open your mouth slightly and keep your teeth apart.
To remove the scan box, hold the retractor in place with your thumbs and pull the box forward. Then remove the retractor. That's it. Now it's your turn to try out your first scan.
So the process is that simple, okay? So the patient does the scan. Now, to make your life easy, as I've already indicated, our office does 2,400 scans a week. How do you manage 2,400 scans without being overwhelmed? First thing is the scans are color-coded with 4 different colors. Think of a stop sign: red, yellow, green, and a 4th color, which is gray. Red, yellow, green are the colors used for the areas that I want reporting on from dental monitoring. Gray is the color that's used for things that, in the interest of accuracy and completeness, are recorded by dental monitoring, but there are things that I don't really care about. So when I look at reports, we focus on red, yellow, green. The practice has to establish when and the languaging of notifications that are going to be sent to the patient, and that's up to the individuality of your practice. So what we've done is create a list of scripted replies to a patient that reflect our style, our languaging, and so forth, for oral hygiene, for not wearing rubber bands, whatever it might be that is an area that we want to use dental monitoring as a communication tool for patients. And then in our office, we do weekly monitoring of cases. And I'd say there's an exception, which is when we do refinements for Invisalign, we switch to 4-day scans to move things along a little faster. Okay, so this is the kind of report that you'll see, and it gives you the right information at the right time. For every patient in the practice, you're going to get those red, yellow, and green reports, which are things we want to address. The gray reports are there just for information. Green means goal is achieved, or it means treatment, that particular aspect that you're looking for is going great. The patient's doing good. They're brushing well, their oral hygiene's good, they're wearing their elastics and so forth. So green also is kind of something that I want to know about, but we don't have to address it other than to say, keep up the good work. Our focus is on red and yellow alerts. Yellow means this might be a problem, but you'll have to check it and decide. because dental monitoring is identified as something that should be looked at. Red means this is a problem. Doctor, decide what you want to do, but you should be definitely addressing a red alert whenever it comes through. The key to driving this whole thing is artificial intelligence. Understand that for every scan that's done, dental monitoring does 353,000 different analytics on one scan for one patient. There's 173 different dental parameters that can be identified within the scan. And your job as the practitioner is to decide which of these 173 you want to know about, which ones you don't want to know about, so that you will get your reports in the red, yellow, green, and gray format. DM uses machine learning to grow the scope and analytics of the screening analytics. DM is the communication tool, not only with you, but also with patients, giving real-time recommendations and text messages or email messages to the patient. There is no other monitoring system that has these capabilities. Okay, so what are my obligations with DM today? Well, first is I had to establish my monitoring list of the 173 different things. Which ones do I want to know about? Which ones do I not care about? So that's a one-time deal that you do as the doctor. You establish what you want to know about. And then you need to determine how to address the orange and red alerts. In our office, Delegation is a tool that we have used for decades, and it's one you should use in your office as well. The doctor's job is to delegate to the staff, the team, reviewing a red and orange alert and identifying how to address it. And the staff then deals with red and yellow alerts. How do you teach the staff that? Well, it begins with when you get such an alert, you do it with your assistant, your clinical staff sitting next to you and say, tell me what I would do in this case. Let's say it's a loose bracket. Tell me what I would do if I see that loose bracket. And they say, well, you're going to have the patient in to replace it. And then my response might be, yes, you're correct. But how about if the patient's next appointment is to remove all brackets? Then what would you do in that circumstance? So then I'd tell the staff, I might not remove the bracket. Is the patient wearing elastics? No. Is there anything where the presence of that bracket is critical to the case that I'm going to be removing brackets on the next visit? And slowly but surely, using this as an example, I teach my staff to think like I think. And over a period of time, those who are identified as my DM champions will review these red and orange alerts. And 99 times out of 100 now, after doing this for 5 years, they know the answer. They know how to address it. They know when to have the patient in. They know what to communicate to the patient, and staff does the work. It becomes a scripted system for activity by the team with very little doctor input. And you might say, how much doctor input? Well, for our 2,400 scans a week, I spend perhaps 45 minutes of my time dealing with dental monitoring related issues for the entire practice, 45 minutes a week. So let me summarize doctor obligations. Set up the custom monitoring protocols, a one-time thing. Teach and mentor the staff how to review the red and yellow reports, and then get out of their way. Let them do what you've taught them to do. And my job today is dealing with own patients, which I will be describing as we go on in the slideshow. That's my primary function within the dental monitoring treatment systems and monitoring systems we have in our office. Okay, let's talk about staff obligations. Key concept, once again, is delegation. You need to delegate for implementation and initiation. You have to have staff trained to teach patients to take decent scans using the scan box and so forth. You need to teach them to teach patients the importance of doing dental monitoring, the value proposition of fewer visits, etc. You, of course, are going to use the staff for monitoring purposes of cases as they progress. This is nothing new, is what I've taught for 40 years in my lectures. You have an advantage I didn't have when I started with dental monitoring in 2016. They have protocols now and great training people that can help you implement dental monitoring in your practice. And now they have a new version, the latest version of dental monitoring, version 2.0, and a better scan box than they had in the past, which makes the whole process easier for you and your team, but also easier for the patient to get a quality scan. Because let's face it, it's garbage in, garbage out. What's the TC's ongoing job? Major thing is communication, which is the job of the TC in an orthodontic practice. But the communication now has to incorporate something else, which is communicating with patients. What is dental monitoring and what's in it for you? This has to be communicated with new patients, with existing patients, with referrals, because referrals will wonder, how can it be that you don't see a patient for 20 weeks? You know, how can you be doing quality care when you're only seeing them every 20 weeks or something like that? And you need to do communication within the community too, that we have the capabilities because of remote monitoring. And we reference the medical model all the time in our area. Because of the ability to remotely monitor, we offer you the convenience of less time taking your kids out of school, less time for you to take off work, to bring your child into the office, et cetera, et cetera. So the major job of the TC is the addition of this, communicating this information to patients in the community. But you also need to revise your patient exam systems. Today, I'd say half of the exams that we see, we've already used dental monitoring as a tool to give a preliminary treatment plan. And in those circumstances, the exam appointment is shorter. The staff takes the record, I review the records, and I basically have a 5-minute talk with the patient and parents saying, I've reviewed the records, and what we told you on in response to your initial virtual visit with us is exactly what I told you it would be. The treatment's the same, the treatment cost is the same, treatment time is the same. Or conversely, I can say, now that I have comprehensive records, we have this new or that new thing that I couldn't possibly tell from the images that you sent me. And the treatment now needs to be A, B, or C. Patients accept that. They accept the convenience of that. And our exam appointments now are half the time they used to be. So virtual exams were the key to that process. Importantly, very importantly, and those doctors who are listening to me know what this point is all about. Unless you change how you schedule, you derive no benefit from technology and delegation. You have to change how you schedule to allow yourself more exam visits because you're going to have them. Because the word will get out that you're offering a convenience no one else offers. And you need to make sure that you're maximizing doctor and staff time for the procedures that will go on. You'll need to change your scheduling templates to have far fewer adjustment appointments and far more appointments that represent nothing but starting treatment and ending treatment, because that's how your days will be filled. It won't be days full of adjustments. What about clinical systems changes? Well, you need to refine how you start treatment. Our start appointments are twice as long as they used to be because we have to teach a patient how to properly take the scans so that we can accomplish remote treatment. During treatment, we use DM to monitor and to communicate, as I've talked about. But we also use DM at the chair to augment treatment decisions and communication. You ever had a patient who says, oh, I'm wearing my rubber bands, and mom is swearing, yes, he's got his rubber bands in all the time, but 18 months into treatment, there's been no change in that class 2 malocclusion. You ever had a patient like that? Well, now you have a tool to prove your position, because you can go through serial scans and show the cuspid relationship has not changed in my example over 18 months. And now you have a tool to demonstrate not only that the patient's not wearing the rubber bands and treatment's never going to get done, but the power of remote monitoring to monitor anything that deals with patient compliance and communication. Now, probably at this point, anyone listening to this webinar is going, yeah, I'm not sure I'm liking this. So far, all I see is more work. Where are the time savings with dental monitoring? Well, let's talk about what's in it for the practice. First, as I've already tried to explain, there's far fewer visits. Now patients only come in when they have to come in for appointments. You run on time much better because before a patient comes in, you know what needs to be done. There's no more surprises like the patient that came in with a loose bracket that you didn't know about, or the oral hygiene problem that you have to use the whole appointment that has been scheduled to address oral hygiene issues and so forth. You can run on time and therefore schedule much more effectively. You'll find doctor time is going to be drastically reduced because of this tool of dental monitoring. And you're going to finish all your cases earlier and better because weekly monitoring allows you to find problems before they become chronic and before they cost you time and appliances. But there's some other advantages of dental monitoring too. How about happy patients? Now, why would the patients be happy with this? Well, it's going to be fewer appointments. It's going to be shorter appointments. They're going to finish faster. And that means less inconvenience. Patients love it. Parents love it. You know, as I've been lecturing on dental monitoring for some number of years now, you know, I run into orthodontists all the time who say, oh, my patients love me. My patients love to come in. You know, we have such a good time when they're there. Trust me, they'd rather not be there. And if you give them a way to not be there and still have a great result in less time, that is a practice builder. Another advantage of using dental monitoring is less time means more profit. Fewer appointments is going to make your profit per case greater. Shorter appointments make your profit per case greater. Less refinements and arch wire changes is going to make your profit per case greater. Finishing patients sooner will do the same. And importantly, happy patients are going to tell their friends. Photo monitoring is the tool that's used for aligners, but also for braces cases or bracket cases using dental monitoring. Here's an example of what photo monitoring can do. If you look at the upper right lateral incisor between these two photos, you can see that the date difference between these two photos is 2 weeks. We're losing the upper lateral. Anyone who does aligner treatment knows that's pretty common, okay? Now, in a world before dental monitoring, and let's say you saw an aligner case every 8 weeks, if this happens in 2 weeks, how much worse will it get in 6 more weeks after that? How many times do you have to do refinements because you've lost a tooth or the aligner's not fitting at all because of poor compliance or whatever can occur in such a circumstance? Well, when you can find an unseat in 1 week, not 2 weeks, you can address it on the spot. You can address the compliance issue if that's what you're dealing with. And you're doing far fewer refinements with aligner treatment. And you're doing far fewer bracket changes, wire changes with bracket cases. So unseat in 2 weeks, it's not a problem in our office anymore. We don't have that problem anymore. Dental monitoring also works this equally well for bracket cases as with aligner cases. In fact, there are more options or opportunities for dental monitoring to make your treatment progress successfully, well, and ahead of schedule using remote monitoring of the case. New in May of last year is dental monitoring version 2.0. It allows even more efficient and cost-effective monitoring of cases, and it's been a huge addition for bracket cases as well. So what does this screen look like today for dental monitoring? Those of you who are using it, this looks familiar to you. Those who have not used dental monitoring, this may not look familiar. So let's kind of break it down into left, center, and right. Left panel kind of looks like this, but in addition to that, you have information on what aligner they're on. You can reset the scanning schedule from anywhere from 4 days to 90 days and so forth. You set the parameter and then it's locked into place here. You provide the information. You have the ability to, let's say in a case of an unseat, of overriding, message it to the patient that would say, don't change your aligner. So you have the ability through this left panel to adjust treatment and to monitor progress of treatment using that information. Center panel is the actual information that is the key, the key to really monitoring cases. That this part of the panel is where it identifies when all the scans were taken. When you have a patient who's poor at taking scans, there's going to be big openings between these dots, because each one of these dots represents a scan. So a non-compliance patient on scans can be easily identified, and you can show them the disadvantage of not doing a scan. A good example with aligner cases is in our office, you cannot go to the next aligner unless we give you permission. There's only two ways we can give you permission. Come into the office so we can check the one that's in to see if it's fitting right, or allow us to remotely look at the one that's in, and we can remotely tell you go to the next one. It's a powerful tool for communication and to monitor and control. Down here, you're looking at photographs, and you can click at these different photos to see different images and different views that are taken at different times in the course of the treatment. So this set of photos deals with this time frame. This set of photos deals with that time frame. Down here is all kinds of information that is available today in version 2.0. Has a class 2 been corrected? Is it a class 1 cuspid now, class 1 molar now? Is the overbite corrected to the level that you want within the goals that you set for yourself and so forth? So down here, you have visually answers to questions on what are the goals that you had in treating the case, and it's all available in that center panel. Now, I found another great advantage of that center panel, which is in patient communication. I'll go back to the example of the kid who's not wearing rubber bands. I will show them this picture, and actually I'll pick one where the teeth are together, of course, but I'll show them this picture and say, look at the cuspid relationship in this picture. And then I will click on any other dot down the line. I'll say, I'll pick one here. Oh, let's go back. I'll pick one, let's say further down the line, like there. And now that time frame for the picture comes up. And I can say, Mom, can you say the difference between this picture and that one? And Mom goes, no. I said, I can't either. That means between this date and that date, there is no change in the cuspid relationship. That means your child's not wearing rubber bands. It's definitive proof. And you cannot have a parent who argues with you about that. Same thing's true with toothbrushing, et cetera, et cetera. It is a hugely valuable tool for patient education and to prove your point that you know what you're talking about. Right panel is basically a recording of information. What you see here is it's showing an area where the brushing isn't what it's supposed to be and so forth. So you can highlight your DM champion in your office can highlight oral hygiene, a loose bracket, whatever it might be that might be necessary for communication. And then this is the communication that goes with the photograph to the patient on a given date. New in version 2.0 is tracking goals. A good way to keep from having treatment going on forever and ever is to track things like class 2 correction, overbite correction, and so forth. So with this new version, you have the ability to track the goals. And as I said before, they're going to show up down in this area on your dashboard. So you can set a goal of I should be done with the class 2 correction in 15 months, 18 months, and it will prompt you when the goal should be achieved and when it is achieved. But importantly, you can set deadlines where it will prompt you, it should be done by such and such a date. And if it's not, you'll be prompted to make sure that you get a little kick in the butt saying, this kid should be done now. You haven't been paying close enough attention. So ongoing observations like oral hygiene and things like goals are an automatic part now of the dental monitoring dashboard. And I could give examples with braces on things that are hugely valuable, like when is a wire passive? Have you ever thought about it? When you're in orthodontic training, you changed the wire every time the patient came in, whether they needed it or not, because that was part of your training. But have you ever thought about how many times you've changed a wire in treating a case and it wasn't necessary? Since I started using dental monitoring, we used it as a tool to determine if the wire that's in is passive or not. I am not going to change a wire until the one that's in is passive. And when I know it's passive, I can now critically look at the images from the remote monitoring scans and determine if I'm done. If not, what do I need to do to change things? What tooth needs to be rotated or tipped or torqued or whatever it might be. And our office is SureSmile, so I order the wire that will give me the changes that I want based upon the images there. And only then is the wire changed. We went from what would be probably 5 arch wire changes per case to 2 or 3, because we learned that you don't take out a wire until it's passive. Same thing with elastics wear and so forth, as we've talked about before. So communication is the other big thing that's so important with dental monitoring, is the ability to communicate to people. Your hygiene is good or it's not. Your elastics wear is good or not. The aligner is fitting or not. The brackets, you're not taking care of when you have a loose bracket. You're not wearing your retainer. All of these different things within the dental monitoring system, you have communication tools to provide that information. So what does it all mean to you? Huge time savings in every case, better control on every case. And today in our office, appointments are on demand, meaning we do not schedule a patient for another in-office visit until there is a need for them to be seen. That's appointments on demand. And that's true for aligner cases as well as bracket cases. We also use dental monitoring for non-compliance issues. When I can remotely monitor a case and see issues of non-compliance, whether it be wearing rubber bands or whatever, and I can track it and I can demonstrate it using the screens that we just talked about, the dashboard. We use it as a tool for patient education, but also for patient communication and validation of the power of dental monitoring. People say, why do I have to do these scans? I don't want to do the scans. It's too much work. Da, 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 da. And when we can show them on the dashboard the after effects of not taking scans when they should, the after effects of not brushing when they shouldn't, through serial scans that show, the negatives of not doing a scan, but also the negatives of not being compliant, it becomes a hugely powerful tool for patient education and keeping treatment on track. So we have 2 new kinds of appointments in our office. The first was the DM mini cons, which is when we see a chronic problem beginning, we establish what we call a mini cons between our staff and the patient, where they use the DM dashboard to illustrate and prove an undisputable thing that is not going well in the patient as a patient education tool, but also it validates the power of DM. When that DM mini cons with a staff member doesn't work, what is then set up next is a doctor mini cons. And the doctor mini cons is one where we lay down the law of what will be done. And it leads to what we call a grace period agreement. So the grace period agreement basically is what you see kind of covered in this part of the slide. I'm going to use the language, we all want to see the same result, but we can see from looking at the dashboard here that we're not getting where we need to go. So, Johnny, what can you do to make things better so that you can progress, so that we can get the result that we all want? And, sometimes you'll hear, well, I'll brush better, or I'll do my scans more, or I'll wear my elastics better, and so forth. And I'll say, you got to convince me. And convince your mother. Your mother's done everything she needs to do. Look at how much money she's invested in giving you a beautiful smile, and you're wasting her money by not doing what you need to do. She could spend that money on so many other things, but she's chosen to spend it on you. And that's for your benefit, because she wants you to have that beautiful smile. You're not going to allow her money to be spent well. So convince your mother for me that you're going to do what you need to do. And what it leads to is something called a grace period agreement, which basically is something signed by the patient, the parent, and me that says, from this day forward, the patient agrees to correct whatever the problem is. The mother has signed it as a witness that the patient has agreed to do what he or she needs to do. I sign it as the doctor who did the consultation, and there's a consequence. The consequence of the grace period agreement is I estimate as honestly as I can how much longer to finish the case. And I will say, if you do what you need to do, and we'll use 6 months as an example, if you do what you need to do 6 months from now, you should be through with treatment. So here's what we're going to do. You've just committed to your mother. You're going to make her investment pay off. You should be done in 6 months. If you're not done in 6 months, we're going to start charging you $150 a month until you are through. Mom, if this comes about, you know why. Your child wasn't doing what he needs to do. I think, Mom, you should make him pay the $150 a month. 99 times out of 100, that gets the compliance you want to finish a case. So dental monitoring even has been a hugely valuable tool for this kind of a problem. So let me summarize a little bit because I want to allow time for some questions. Dental monitoring allows reduced doctor time. Own appointments means only when necessary. And when we finish a patient, let's say that's been in the office for an adjustment or something like that, our next appointment, instead of saying, I'll see you in 8 weeks to change the upper wire, or what would be a typical thing, I say, next visit, own 10, own 6, own 4, whatever it might be. Own means that it's my job as the doctor who's providing care to look at their dental monitoring scans in a set number of weeks, which is the 4, 6, 8, 10, whatever, and identify if compliance has been good, treatment has been progressing, and so forth. That's an own appointment, which is a remote visit of their treatment progress. ND appointment means no doctor needed. How many cases do you have in your practice where they need to be scheduled, but let's say you're using C-chain for space closure? We all know C-chain is fatigued, it's passive in 3-4 weeks. So if you're going to use C-chain for space closure, you might need to change it 3 or 4 times. What I will do in my office is schedule ND 3, 6, 9, and an own 12. That's what I would dictate. That patient will then be in 3 weeks, 6 weeks, 9 weeks for C-chain only, which is a no doctor appointment. In Illinois, where I practice, the staff can change C-chain as long as the doctor's present. So on ND days for ND appointments, the staff is doing all these, adjustment appointments, if you will, and I'm doing treatment plans or whatever else it is that I need to do so that I never have work to do when I leave the office. You have to decide how you're going to use the found time with this kind of scheduling. But you need to rethink how you schedule, how you think going from in-office visits to virtual visits. And what you need to do also is rethink job descriptions for your team, because with fewer adjustment appointments, you have just created time for your team to be doing these new dental monitoring related activities. In fact, what we have found, even in a practice that has grown 25%, we're treating patients in fewer days in the office with fewer staff because of the efficiencies that come with using dental monitoring as a tool. So once again, I think this slide is probably the most important one of the whole program. When you save that kind of adjustment time, it is hugely valuable to you and your practice. So we've talked about appointments on demand. How does it work? Remote monitoring allows us to weekly check progress. It's AI driven, it's accurate. Team only does these ND appointments, no doctor appointments. And as I said, I do all the own appointments. That's what I'm spending 45 minutes a week addressing, because those are the patients where we said, I want to see the records in 10 weeks, 12 weeks, whatever it might be. It costs me 45 minutes a week to manage 2,400 patients in dental monitoring. Let's talk about retention. When do you end retention with a patient? That's been a question orthodontists have dealt with for decades. You know, when do you let go? When do you kick them out of the nest? Some orthodontists want to keep them there forever. It's like, I don't want them to leave until I finally have had a chance to see relapse. Others want them out of the office the day their brackets are removed, and they don't want to see them again because they don't want to see relapse. And the rest of us are somewhere in between. So when do you cut bait? Because you have to cut bait, because retention visits are things that fill up your appointment book that don't make you money. Here's our retention policy. Our policy today is we will see you for a year after appliances are removed. At 3 months, it'll be a remote visit. At 6 months, it'll be an in-office visit. At 9 months, it'll be a remote visit. At 12 months, we do final records through out of the office. However, we offer our patients today who are using dental monitoring the option for us to guarantee our treatment results for 10 years for $800. Now, if you're remotely monitoring with them, and part of the guarantee is they have to do their scans every 3 months. If you're remotely monitoring every 3 months, how much can a case relapse, a rotation relapse, a tooth tip or move? If they're wearing their retainers and they're doing scans every 3 months, I submit to you, you won't be retreating a lot of cases. I've been doing this for 4 years. I've had to do limited retreatment with aligners, 6-month treatment on 3 cases. Again, remote monitoring allows me to catch a problem before it becomes a big deal. And frankly, our retention guarantee is a new profit center for treatment of patients. I'm going to finish with one more thing. I kind of began to a little bit allude to the fact that the only way the orthodontic profession can scale to a level that we can provide care that matches the demand being created by the likes of Invisalign and direct-to-consumer companies is collaboration. What we've created in our office is a collaboration between our practice and a group of 30 dental practices, where the dentist does the easy cases, basically, for those patients seeking better and not really needing a lot, and we do all the rest. So that's a collaborative treatment. In that collaborative model, our office takes all appropriate records. We do the diagnosis, we do the treatment plan. All these patients are treated with aligners. The aligners are delivered to the dentist provides the care, but we with dental monitoring are looking over their shoulder. It's a beautiful model, it works. And I've been doing it, as I said, for 3.5 years. And the best part is the patient wins because they're getting specialty driven, convenient, and competitively priced care. Everyone wins, and it's very profitable for the dentist and the orthodontist, and it does offer an opportunity to scale to meet what is a growing demand. So, time to summarize so that I have time for questions. Disruptions abound. They're not going to go away. They're happening more and more frequently. Aligner treatment has made treatment easier and less time consuming. It gives consumers aesthetics and convenience, which is what they want. How consumers shop today has changed forever, as I've explained. Direct-to-consumer is not going away, and the government and insurance industries are going to continue to apply the medical model to reduce costs for the services we orthodontists provide. Millions of dollars will be committed every year to create demand for better. So how will we face this demand for better and the volume that's necessary? How do we scale? Because if we don't, someone else will. We can capitalize on their marketing, the hundreds of millions they spend a year on marketing to drive the demand for aesthetic orthodontic treatment by providing superior doctor-driven care, and we can scale. Partnering is the key, but it's only possible with dental monitoring. And with that, I will turn it over to questions from the group.
Hi, Dr. Sellke. Thank you ever so much for that. That was fantastic. I certainly learned a lot myself about what you've built there at your practice and the efficiencies for sure. So we had a couple of pre-questions that came in that will give people a chance to drop some questions into the live chat that we're there. Are you being at all selective on the patients that you're putting into dental monitoring?
Am I being selective? No, 100% of our patients get it. 100%. Patients on observation, we use it because I'd rather remotely see if the teeth have erupted or not than have them in the office. We use it on all the retention cases. We use it on all of our bracket and aligner cases. So 100% of patients get it.
Perfect. And just you mentioned about the superior sort of patient experience. Are you sort of seeing that through feedback from patients as far as leaving the all-important Google reviews for the practice, which obviously help drive that sort of word of mouth referral piece for you?
Very much so. Very much so. Our Google reviews are very high and they're in quantity. So, and it's driving people to the website where, of course, we use the website as an opportunity to explain what is dental monitoring, how it works, and what are the benefits to them. Yes.
Great stuff. And you mentioned obviously looking at the compliance for children. Do you also have a protocol for adults who are not compliant within the practice?
It's basically the same one. I mean, the adult non-complier is really no different aside from age from the child non-complier. And frankly, we have more adults not complying than kids.
Right. Okay, great. I'm sure that experience is mirrored as well. Let me see. Oh, sorry, 1 second. So we've had a question. How do you charge observation patients if you give them DM, but they are not in treatment as yet?
We don't charge. Don't charge. Because I'm still saving the money of an in-office visits. So I'm not worried about, the DM only charges when I do a scan. So if I have a patient on observation where, let's say I'm waiting for them to lose baby teeth and permanent teeth to come in, we'll have them do a scan every 3 months, every 6 months. I only get billed for that one scan at 3 months or that one scan at 6 months. It's not a monthly bill. The cost is minimal compared to the cost of just having the patient come in for an in-office visit.
Mm-hmm. Okay, great. So we've had a question from existing customer who's saying, how do I manage delegate jobs to cater to our growing DM patient numbers?
Repeat that, please.
How do I manage delegate jobs to cater for our growing DM patient numbers?
Well, I think the big thing is team buy-in. Okay, it has to start with team buy-in. I know that there are circumstances where staff, let's say, would be concerned about losing their job. I used to be a chairside assistant. My job would be to move 15 patients a day or 20 or whatever it is through the office. That's my responsibility as a clinical assistant, treating, doing adjustment appointments. And all of a sudden my world has changed. I'm not doing adjustment appointments anymore. Oh, gee, is my job in jeopardy? What has to be done is to tell these people, you're not going to lose your job, but you have to accept a change in your job description. You will still see some adjustment patients, but not as many. Instead, you're going to be doing a lot of remote monitoring, in our case, 2,400 cases a week. That's what you're going to be doing instead of working at the chair. It's just as valuable and it is just as worthwhile, but it is a different role.
Mm-hmm. So are there any particular characteristics that you found are good to be the DM champion within a practice? Is there someone allocated specifically, or are you sort of spreading that based on?
In our office, we have actually 6 people that do these DM activities. Why? Because I think with 2,400 scans a week, it would be fatiguing for one person. So this way it's spread among 6 people, and you never want to have a person who, let's say, leaves the office and is the only one who knows how to do something. So I'm a big believer in cross training and so forth. And when in our office, when we spread these, 2,400 scans a week over 6 people, the time it takes them, each of them is let's say 4 or 5 hours a week to do all the cases, rather than one person, and that's all they do.
Okay, great. Another question, how do new patients or observation patients get a scan box, and who pays for it?
We don't make patients pay for any scan boxes. We give them to them. And as far as the instruction, we have on our website, but also if the patient has access to, through DM app, how to do the scans and so forth. So the patient education part is available to them as a repetitive process. But when we give them the scan box, they always do their first scan in the office with our assistant watching, monitoring, making sure that let's say when they do the scan, that they're showing the most posterior teeth and the occlusal view is good. In other words, we'll say, that you didn't turn your head enough or you didn't open enough, so that the patient understands what it takes to do a good scan. And then that, plus the ability to review, the tutorial that DM's already created, we don't have a problem. And again, I know there are practices that, let's say, sell the scan boxes or charge for dental monitoring. In my mind, that's false economy. In my mind, if I have one less visit in the office, that pays for all the costs of dental monitoring. So anything after that is a profit.
Great, thank you. So just a question on SmileMate usage. I know you look at numbers, very numbers driven, which I'm a big fan of. In order to make decisions. Did you find that SmileMate has improved the conversion rate of patients that start into treatment within the practice?
I think what it's done is it helped me weed out the shopper from the actual patient. The conversion rate is the same before we did SmileMate and after we did SmileMate, but the doctor time, the in-office time is dramatically less and the failed appointments is less because we weed out those who just kind of want to get an idea. I didn't think it's going to take 18 months to do my case. I don't want to spend $6,000, whatever. They don't show up, or they don't even schedule the appointment once they know, they've got the answers that they don't want to hear. So we're not wasting our time with appointments for patients that are never going to start.
Okay, great. Thank you. So just looking at the questions, I think that's all. We're pretty much on time. So yes, any final words, Dr. Sellke? We would hope at some point we would love to get you over to Australia next year if we could, to go more in depth on this, because 1 hour is obviously not long enough.
Obviously this is enough to wet your whistle, to give you kind of a basic understanding of how it works. But ultimately, as I've taught in my lectures for decades, it's all in execution. I would love to come back to Australia. I've done programs in Australia a dozen times. And I think if I ever were to come to Australia, which I would do, I would think it ought to be for like a 2-day course where I would bring my staff and the doctors in attendance would bring their staff, because there's nothing that buys staff in more than talking to the staff of a doctor who's doing it. And they're finding out how they can do it in their office, that what the lecturer is saying is actually really how he does it. It's not bullshit, that kind of thing. Too many times a doctor will go to a meeting and get all excited about something. They'll go back to the office and he gets a bunch of blank stares from the staff. Like, there's number one, there's no way I'm going to do this. No. Number two, are you that stupid that you really think this guy does that? He doesn't do that. He just made a good lecture, But when I bring my staff and my staff says, yes, we do this. This is exactly how we do it. And here's how you can do it in your office. Suddenly the credibility's there and the staff buy-in's there.
Great. Totally agree. Totally agree. So thank you again ever so much. Thank you for your time. Thank you for everyone that's participated. I know people have stayed on probably a bit longer than they needed to, but you know, if they've got clinical time. So thank you for that. And say the recording will be made available to everyone that's registered. So please rewatch at your leisure, and obviously reach out to Dental Monitoring if you've got questions. And obviously we can talk about your particular circumstances.